series here on Twin Cities Live. They're all about health and wellness. It's our Be Well with TCL series, and today we're tackling our skin.
TCL reporter Kelly Hansen joins us in studio, and Kelly recently learned a lot about skin conditions related to COVID-19. This is an interesting twist. Hi, Kel.
I sure did. Hi there, guys. Okay, so you're aware of the common symptoms of COVID-19, fever, cough, shortness of breath, but have you ever heard of something called COVID toes?
Steve's got enough trouble with his toes.
I have bunions. Don't tell me I've got COVID toes now, too.
Okay.
I read this. This is so bizarre.
What is it?
So it's a condition that's popping up for some patients, and many have noticed it before they even develop those common symptoms we just told you about. So the toes can look like this. They become reddish purple. They can be tender, swollen, and have itchy bumps. Well, here's why. It's an immune response to the virus, and doctors believe it's an inflammation in the blood vessels that cause that swelling. What they've also learned is that typically people who have COVID toes don't usually go on to develop other serious symptoms.
Oh, it's sort of like a good thing.
Yeah,
I'd take those then.
If you've got those, maybe you want to see your dermatologist or your physician. But when I stopped by Advanced Dermatology Care, I wanted to know about other skin conditions brought on by COVID, more specifically from wearing a mask.
Yes, when your skin is being occluded or covered, it can aggravate certain skin conditions. It doesn't necessarily cause skin conditions, but it can aggravate people that might have a condition called perioral dermatitis, which is a rash with bumps and irritation around the mouth. People that have seborrheic dermatitis, kind of a peely, scaly condition of the skin. Regular acne can sometimes get worse as well, and if people choose to wear makeup, and then that gets kind of ground into the skin, and people can break out a little bit more from that.
We're calling it maskne lately.
Maskne.
Yeah.
Maskne, we're hearing a lot about that.
I know, it's no fun. So what do people do about it, though,
So
Kelly?
if you are breaking out more, they say try not to wear makeup under your mask or as much makeup, and wash your face every night with a gentle cleanser, and that's just the easiest thing to do to try and keep those pimples at bay. Okay,
yeah, I wonder if men are struggling with that a little bit more too, you know?
Yeah, possibly with like the facial
Just
hair
like the
as well.
friction, and
Sure.
I mean, more guys probably are less likely to wash their face at night because they don't do makeup.
Yeah.
Yeah, and the key is to find a mask that fits correctly, and that also is something
tricky.
you should try out. Yeah, so okay, so speaking of masks, is it safe to wear a mask? There are a lot of questions about whether that is safe or not, and here's what Dr. Ruth Rustad had to say about that.
Oxygen levels stay the same whether you're wearing a mask or not. Carbon dioxide, CO2 levels, they stay the same whether you're wearing a mask or not. They don't increase or anything like that. So it's totally healthy to wear the mask. It just takes a little getting used.
Takes some getting used to.
And I
That's
think finding
interesting
the
to
right
hear.
mask. I don't think I found the right one.
I don't think I have found the right mask yet, but I keep seeing news about different sorts of masks, and so then I think, oh, well, maybe that would be more comfortable for a longer period of time, because that's, I think, part of the struggle for folks is if you just have to throw it on and off real quick, cool. But we were just talking beforehand, we're going to get an announcement hopefully within the next week or so about guidance for this fall semester for school, and we're wondering how long would masks be encouraged or mandated to be worn. I think you just say the word mask right now and you'll get all sorts of opinions from all sorts of people. It's
I know.
something.
Yes.
I know. And, you know, Dr. Ruth Rustad was saying if you have glasses or you wear your sunglasses
That's
a lot
so
with your
tough.
mask, so here's what you do.
Mine
You put
fog up.
All the time.
Here's how she says to avoid that. You put your mask under where your glasses would sit. So don't put your mask down lower and let that air get out. You put your glasses touching the mask on the outside. Try
Okay,
that.
because listen, I walked out of the grocery store the other day.
Oh, yeah.
I could see nothing because I was like, ah.
And imagine, look, that's us with sunglasses. Imagine if you just wear spectacles all day long. That's a real drag.
So, Kelly, here's another question, because I know people are going into doctors' offices now, but are virtual visits still possible? Because a lot of folks are saying, you know, they're kind of weighing the risks and benefits, and dermatology care might be something that they'd like to be able to still do virtually.
Right, so at Advanced Dermatology Care, they are now seeing patients in office, which is really important because they do surgeries to remove skin cancers. But if you have something you just want to be looked at or have a question and need to get in, they are still offering those visits virtually.
If you already have pulmonary disease or you're a smoker with increased risk to your lungs or are immunosuppressed, anything like that, we still want our patients to be able to get care. And so that is an option.
Yeah, so if you need to be seen in person, you still can do that. Or if you like to do it from home and it works for what you need to be seen for, they can still do those visits virtually.
Oh, that
That's really
sounds
great.
good.
I want to do
That's
as
great.
many things as I can from my couch
Yeah.
as possible.
Yeah, it feels good. That's one of the
Couch is
real
like it.
positives
Great.
of this
Hey, Kelly,
situation.
can you smell me?
You smell great.
Okay, but you can smell me as well. The aroma,
It's
I
pungent.
I
It's
smelled
pungent.
it immediately when you walked in the office.
Yeah.
I said something about it, didn't
yeah,
I?
you
Smells
smell.
nice.
If you smell something, say something. Thank you, Kelly. Hey, if you do need to be seen by a dermatologist, virtually or in person, you'll find advanced dermatology care location details on our website. They're in beautiful White Bear Lake, Forest Lake, and Stillwater.
Boy, they pick good locations.
No kidding. A big thanks to them for sponsoring Twin Cities Live. Coming up next.